Hello, Alberta. This is David White, interim leader for the Freedom Conservative Party of Alberta. And as promised, I wanted to spend a few moments with you just to do a bit of an update on Italy, the world, and ourselves with this COVID-19 situation. I'm not going to call it a crisis, it's a situation. Again, I've been crunching numbers and taking a look at Italy, which of course is a significant hotspot with an unprecedented amount of deaths as a result of this virus, now over 10,000 to my understanding, and trying to find out why that country, let alone in the entire world, but in all of Europe, has such high numbers. And here are some of the facts that we've been able to come up with. One, we have a country with over 60 million people in the size of a country that is less than half the size of Alberta, or approximately half the size of Alberta. So 14 times our population here in Alberta, crammed into one half the size of the province, with a significant number of those people being elderly. That's one major factor by itself. Another factor is, and this is something I've always wanted to get access to, is what are the patients that are being compromised and what are these patients that are dying? And from what I'm seeing, over 48% of these patients are elderly with 3 or more medical conditions that have already threatened that person's health. So you have an elderly person with 3 separate issues, plus this virus pushing them over the edge, and now they are dying regrettably. And I'm not trying to diminish these deaths. These people are real people. They're not just numbers. We need to keep that in mind. But now we're already starting to get apples and oranges. This particular bug doesn't target it doesn't kill normal, healthy adults and children. We're talking about, again, the elderly and the immune compromised. So those are critical components by themselves to keep in mind. Another significant thing to consider is a cultural point of reference. How do people in Italy welcome and greet one another? They kiss one another on the cheeks. Now you have raw saliva on their face, where if another person's immediately kissing, again, now you have saliva transfer. This is the raw bug. Secondly, you also have it on the face, and people instinctively touch their faces multiple times in a day without even being conscious of it. So this could be a significant component as to why this bug is spreading as fast as it is in that particular country. There is another thing to be looked at here, and this is with regard to the seasonal flu. Globally speaking, as well as North America and the United States, are numbers that I've been looking at. Globally, there is reference to an on average death. Now, this is not up to the minute, but on average, if I'm not mistaken, we are talking, I'm just having a look here, 291,000 to 646,000 people will be dying per year from the flu, according to some sources that I've been getting access to. Now, something else to look at here, this year alone, there is approximately 34 million people who have been in contact or who have contracted the flu in the United States, of which I am looking at 400,000 hospitalizations and a death rate of 24,000 people from the flus this year in the United States alone, not globally, just the United States. And this is a particularly bad year as far as the flu is concerned, because it is hitting not just the elderly, not just those with a compromised immune system, but it's also hitting children and infants. And it's a particularly unique situation because normally we get hit with one flu, then it drops down, then we get hit with the other one. These two flus, type A and type B, are almost one right after the other before we even get a chance to recover this particular year. And yes, our influenza vaccines are out there, and yes, those are still having an effect. So certainly I would not take away from the vaccination programs. They're worth their weight in platinum. But again, apples to apples and apples to oranges. So you have 400,000 hospitalizations, 24,000 dead, 39 million cases of exposure in the United States alone, whereas globally speaking, you have 702,000 cases of confirmed virus, 26,000 hospitalizations, and we are talking 33,000 deaths. These are ballpark numbers. This is not the pandemic of all pandemics. This is not what we're supposed to be panicking about. This is not Ebola. This is not a level 3, level 4 disease. The reaction that we've had is vastly overreactive. And even now, we are still missing middle steps. Finally, the federal government has decided to activate what I call the sentinels, the healthcare professionals who go out to the ports of entry and start screening. They're just starting to do that now. And this inference of utilizing martial law, this threat of, if you're not going to do it, we'll make you do it. We don't have the military structure to be able to put an entire country into martial law. And just making that type of a threat is as irresponsible as it is reckless. It reminds me of a Justin Trudeau who stormed across the aisle or stormed across the floor, grabbed a member of the opposition by the arm to drag them back in a tantrum in order to start a vote when no such action was required. We're also still missing middle steps here in Alberta. We're missing the decentralized reception areas. We're missing having the gatekeepers to do assessments outside the hospitals. We're missing these things. If you're that concerned, certainly shut down transport or travel into the country other than those who hold Canadian passports. We are still doing the self-isolations. We're doing fine, people, as far as this bug is concerned. And again, I'm not diminishing the fact that this thing can kill. It can. But it is not the big, bad, ugly pandemic that will kill half of everybody that it comes in contact with. We're nowhere near that. So, again, take a breath, everybody. We are actually doing better than what we are. And there's no need at this stage to shut down our economy, to do harm to our economy, and to keep our businesses and our ability to function at an all-time low. Combined with the price of oil, this is just a horrific hit to our province. We need to start getting back to normal. Again, put these middle steps into action. Get these protective measures in place, and let's start functioning again. Until that point, though, Alberta, again, relax, take a breath. If you've come down with the 19 virus, I'm sorry. I know that it's not going to be a fun time for you. For those of you who have lost loved ones as a result of this, my heart does go out to you. I'm not, again, diminishing these losses, but I am trying to put it in perspective. Take care, Alberta. More to come again soon. Stay safe. Bye for now.